Every Tuesday, Fleetwood's iconic Marine Hall echoes to the sounds of the town's community choir.
We all encourage each other to sing, dance, and we all enjoy it.
We all sing together and support each other, and it's cheap and we just have a good laugh, really.
Harmony and Health's been going for 6 years, and it's one of dozens of groups in Fleetwood aimed at keeping people happier and healthier.
Instead of thinking, I'll go to the doctor, he'll fix me, in Fleetwood we've got a great community and we all try and fix ourselves. And we try to get things like this going so that people can think, I've got something to look forward to, I've got hope.
Healthier Fleetwood was set up by a local GP in 2016 to try to tackle the poor health associated with high levels of deprivation.
Our healthy life expectancy in the town is 52, so that's the average age of onset of a condition that will significantly have an adverse effect on your life, such as chronic respiratory disease, chronic heart disease, chronic pain.
The idea is that happier, more connected people lead healthier lives, reducing the pressure on the NHS. But there's only so much you can do for yourself. Is anybody here waiting for any kind of surgery or procedure or test with the NHS at the moment? So quite a few of you. The past few years have seen huge pressures on the NHS.
It's not as broken as perhaps some people would like to make out, but it clearly is in need of some TLC and a period of stability.
Professor Sheard heads the Institute for Population Health. She says funding hasn't kept pace with the ever-increasing demand.
Part of its success is part of its problem now. So people are living longer, but they're living the later part of their life with more ill health, which has a considerable cost for the NHS.
And then there's the impact of the lack of social care.
There isn't enough people and they're not given enough time.
Have you had to go into hospital sometimes because the help hasn't been available at home, because the social care help hasn't been available at home?
Once or twice, yes.
And that struggle for staff is also throughout the NHS.
We have a large number of GPs now in the country who are in their 60s and retiring, and filling those vacancies are getting harder and harder and harder.
So what to do? Everyone agrees that schemes like this are infinitely better than waiting until people get sick.
We simply can't continue to only concentrate on helping people with their illnesses. If that's all we do, we are going to get busier and busier and busier and busier as we help people with more and more long-term illnesses.
So the NHS has to change, but there is still a sense of a future.
I think the NHS is working. I think it's working very efficiently with the resources that it's got. It's a universal healthcare service. It covers everybody. It is a brilliant example of what we do so well in terms of civic social responsibility.